The Stephen Handisides Show is sponsored by BMI Healthcare, Neostrada Skincare, New Skin and Body Face Couture.
Welcome to the Stephen Handisides Ultimate Beauty Show. Step inside my ultimate beauty clinic and discover a world where the very best aesthetic, beauty and fitness experts will be demonstrating to you just what can be achieved. Whether you want to look younger, change your image, get fitter or sleep better. Just because you feel tired, it doesn't mean you have to look tired. So coming up, we talk to Mr. Dirk Kramer, who can banish eye bags and tired eyes. We also find out what a natural looking breast augmentation looks like and find out how we can get that celebrity look for the season. We are here at the Cosmetic Clinic where all the action happens. We've got some of the UK's leading experts right here and some really exciting treatments. And we're going to kick this off with Dr. Barbara Kubicka, and you are doing mesotherapy treatment, is that right?
Yes, that's right.
This is just astounding. And will actually improve the hair? Why are you injecting there?
So we can use mesotherapy for different indications. In this case, we use it for the improving very thin and fine and...
So in the areas where especially women tend to lose hair?
Absolutely. It takes 4 to 6 weeks to see the first results. Initially, what patients notice, they notice the less fallout of hair, and then the hair that they have already, they get stronger, and then after 6 weeks, they see the new hair growing.
So you'll start getting little baby fine hair, and then
Yes.
it'll actually thicken up like the rest of her hair?
Yes, if we continue with that, we have to continue quite long. It's a maintenance as well.
So it's also good for the face, mesotherapy?
Absolutely.
Yep.
We use a lot for like general conditions. So if we want to hydrate skin, we'll use obviously product like hyaluronic acid to hydrate the skin. But as well, if you want to brighten, we have a different cocktail for that. And sometimes we use as well around the eyes for puffiness around the eyes, which is absolutely fantastic because it improves the circulation of the lymph and blood around the eyes.
So it's not a volume filler, it's very much a rejuvenation type of
Absolutely.
treatment.
Yeah.
You even said that in the States, they use it for fat reduction.
Yes.
And you said that it can be used on the side where you see women have around the knees, that it will actually dissolve it? What happens?
So it does improve as well, once again, depending what product we use. We can choose substance that will stimulate the circulation and improve the metabolism in that
So the body actually does
yes,
it. So
and
it
the body does
body,
it. So we
stimulate
stimulates the body to do this. So it's a very natural way, but very specific as well. So we can, as you said, choose the pockets of fat that are quite stubborn and we are not able to remove them with exercise.
Yeah,
Great.
that's
Okay, that's brilliant.
Fantastic.
Right, well, let's have a look at another
All right.
treatment, the next one.
Thank you.
Right, we're here with Dr. Prima. What treatment are you doing?
So I'm actually straightening up the jawline. As we get older, our mid-face tends to fall and our elasticity goes so that we start to look a little bit jowly. And so the best way to do this treatment is to start with the mid-face and put some dermal fillers in the mid-face to give a slight lifting. And then after that, to place some Botox in the top of the platysmal muscles, which will cause a little bit of a lift. And once seeing that result about 2 weeks later, then we can inject with some more dermal fillers along the jawline And this, I have already finished this side, and I've injected all along the jawline here and right up next to the ear to give a little bit of a pull.
So she'll get better definition around the jawline. What sort of age bracket is it?
So it's usually once someone's reached mid-40s upwards. Everyone's different. And the other thing with my patient here is that also I will be putting a little bit of dermal filler in the chin to just bring that out a bit, and it creates a nice contour as well.
It's already, since you did it before, it's softened up a lot, even in that time. So will it continue to get softer and the lines will soften?
It will continue to volumize over the
Okay.
next 24, 48 hours, and it lasts about a good year.
Danielle's loving this. She keeps saying that's another treatment to put on the book. So, okay, great. Can we see the results
Yes.
of half the face? That would
Yes,
be
so we've
great.
done this half. Do you want to sit up?
So Kim, yeah, great. If you could sit up.
And we've actually treated this side of the face here.
Wow, you can really see a difference here.
Yeah, that lumpiness is out.
So
It's
Kim,
much
was
more-
it painful? Tell us about your experience there.
No, not painful, just a little bit of a pinch. And that was it. It's not painful now.
So if she continues to do it, will that line again continue to smooth out and stay longer?
Absolutely.
Yeah.
Great. And Dr. Primus, this is a treatment for men and women?
Absolutely.
Okay, great. And what sort of roughly would be the cost for something like this?
So it all depends. Probably about 2 mils, approximately between 600 to 800 pounds, depending on the patient.
Great. Okay, brilliant. Thank you very much. That's fantastic.
Looks good.
Now, our final expert, Dr. Rajdaz Burmick, consultant ophthalmic plastic surgeon.
Hello.
Hi.
So what have we got here today?
So this is Rachel. Rachel came to me complaining of excess skin on her upper lids. It was causing the skin to rest on the lashes. She was having problems with tearing of the eyes because the tears were wicking out to the outer edge. She also felt that she had a tired look about her, and she was using her brow to try and keep her eyes open. And so Rachel's come to me just to have the upper eyelids assessed and treated. Now, if we look at Rachel, if we look at the left eye here and we expose the brow, if we negate the power of the brow, we can see that actually there's a lot of excess tissue here. And if I just pinch it very gently with some blunt forceps, we can see that it's actually a lot of tissue here which actually hood over, and this is particularly pronounced first thing in the morning. So we can offer a simple surgical procedure called a blepharoplasty, where we remove the skin. It's done using a very high frequency radio frequency nerve which cuts and coagulates as we go along. I also address the muscle underneath so that the skin sits flush and you get a good effect from all directions, not just from in front. In the same incision, we can address the muscle that's responsible for the crow's feet as well. So offering not a permanent Botox, but it's effectively addressing the muscles which cause.
So
the
are you
pain,
doing
the
more of
crow's
an
feet.
upper blepharoplasty rather than a lower? Is that right?
That's an upper lid blepharoplasty. Now, a lower lid blepharoplasty can also be addressed. Rachel really doesn't need a lower lid blepharoplasty, but had she had bags underneath her lids, that could also be addressed, but that's addressed through a hidden incision inside the lid, so there's no scar involved on the outside, and I put a tightening stitch in the lower lid just to lift everything up. The upper lid incision is actually hidden within her normal skin crease, so if I get Rachel just to look down for me, we can see underneath this fold there is actually a skin crease which exists down there. So all I do is incise into that skin crease and reform that skin crease using self-unraveling sutures, which if they've not come undone in a couple of weeks, I
So
take
how
those
do,
out.
how do you know if a patient is how does a patient know if they're a typical candidate for something like this? Do they come in for a consultation with someone like yourself, and what's involved with that?
Stephen, what usually happens is patients usually fall into one of two areas. They usually come in either to have a rejuvenation of the periocular area. They may be feeling tired, they may have some excess skin or wrinkles in that area that may need addressing, or they've got visual problems. The hooding can get so severe that it rests on the lashes point downwards, or they just can't see at the top, or they end up using their brows in order to try and keep the eyes open. So those are the typical patients who come in for upper lid blepharoplasty. Lower lid, it's usually bulgy lower lids. It's aging them unnecessarily, so it's just refreshing the look.
It's a very safe procedure.
Now, it can be it is a safe procedure. You've got to know what you're doing. Now, it's a procedure which is best handled in the hands of somebody who's trained in eye surgery, so an ophthalmic plastic surgeon. No procedure is ever going to be 100% safe, but you've got to have the procedure done by somebody who knows how to deal with any possible complications. Complications are very low, but they can be serious, and so you must go to an expert in order to be assessed fully. You must have a full ophthalmic assessment in the first instance. And my default status is to say, I'm not going to operate, you've got to convince me to operate on you, and provided it is safe to proceed, we make every assurance that we can to try and perform the safest possible surgery.
Well, I think that's
And
some
you
great
know how
advice.
they, like originally when people started doing it and they'd get that pulled look, you can do it and people can look natural?
No, it's very interesting because I have patients who come to me who've had that surgery done, and I have to redo that surgery because they often have patients flying in from abroad because they don't want to get their surgeon in their own country. So they come here to have corrective surgery, and I don't like that look because in ophthalmic plastic surgery and eyelid surgery, if you take away too much skin, you artificially age somebody. If you take away too much fat, you're going to give them a gaunt look. So less is more, and I really don't like that Hollywood stare. So less is by far more.
Yeah,
I think that's
good.
some great tips. Thank you so much for that. And
Thank you.
you know, the viewers at home, if you are interested or considering any of these cosmetic treatments, then please go to the website myfacemybody.com. Hi, I'm here with Mr. Ash Masabi, plastic and reconstructive surgeon, a specialist in breast surgery procedures. Welcome to the show.
Thank you, Steve.
Now, we have a number of A-class celebrities here that have had breast surgery procedures, some more tasteful than others.
Yes.
Where has breast surgery gone these days?
Breast surgery, breast cosmetic surgery remains the most popular cosmetic operation in women, still in UK.
Is it safe? Because I know we heard a lot about this PIP implant scandal.
Yes.
How safe are breast implants today?
Well, breast implants are gone through a number of changes throughout the years. Now they're the 5th generation silicone implants, and they are consistently shown to be safe, safe implants if they're used appropriately.
Great. And you were talking about this previously, was when mothers might, you know, they've had babies, their body changes.
Yes.
Is this a typical patient that you would see in one of your clinics?
Yeah, typically we have sort of two groups of patients. One are young girls before they've had children, and the other group after they've had children and the breast has lost all its shape and volume.
And what sort of procedure would they have? Is it an uplift, or is it for more volume?
So if they've become very saggy and droopy, they probably need a combination of uplift and augmentation. Sometimes it's just they've just lost volume, and then augmentation is sufficient for them.
And are people's expectations realistic when they come and see you? Because, you know, some people always, they see these pictures in magazines and they go, I want those breasts.
Yes.
How realistic are people?
I think over the last few years I've noticed that people have become more discerning, ladies, in the sense that they want to become more natural. They don't want to show that they've had augmentation. So they're becoming more sensible, but obviously if they're not, I have to sort of go through it with them.
And is there different shapes of breasts that can create that sort of more natural
Yes,
look?
I mean if they're very, very small, we can put a shaped or teardrop or gummy bear implants, or different names for it, or a standard implant or a round implants, which works in most people.
Great. And if someone is considering at home having a breast surgery procedure, what would be the sort of the downtime afterwards? Because obviously wanting to keep it very realistic, they would have to take time off work, is that correct?
Yeah, it's normally done as a day case, so they go home the same day. But I'll tell my patients, usually take a week to 10 days off work and don't do anything strenuous for a good 3 to 4 weeks.
Great. Well, that's fantastic. Thank you so much for that information.
Thanks, Steve.
And if you want to ask any questions to Mr. Ash Masabi on myfacemybody.com, then put your questions in and he will be able to answer those for you.
Hi, I'm Danielle Lynn, and we are here at the Beauty Boutique, and we're going to be giving you all of the hot looks this season on the red carpet. We're also going to be giving you tips and tricks that you can do at home that the celebrities use to sparkle. So I am here with Natalie Love, and we're going to be talking with her about a hot look for her hair and the things that she's going to be able to do. And we're also going to be talking with Nadira, who is an international makeup artist who is from Glow Minerals. So tell us what you're going to be doing.
Well, today we're going to be creating some Hollywood waves. They're really hot on the red carpet. Some major celebrities wear them, and the reason why I'm showing you guys these look today is because it's quite achievable at home. It's really classical and really beautiful as well.
Very soft already. It's starting to look good. And Nadira, what are you going to do?
I'm going to focus on that Hollywood glamour look, but in a more modern way, because we're using more modern light minerals for the makeup. So the base is quite classic and clean, not too much glow on it. And then it's all about the eyes, defining the eyebrows and the lashes, really long lashes.
Yeah, you were saying that that's the most important thing, and when I come back you'll show us, but you were saying that you really focus one thing for that camera when you're working with the celebrities.
Absolutely. If your aim is to achieve definition on the eyes and bright eyes, you start with that.
Okay, well, let's get started, and what I'll do is I'll come back and we'll get to see the finished look. All right, we're back again, and so exciting. This is really a transformation. Well, how are you feeling?
Beautiful.
Yeah, no kidding. She said she could get used to this, and I can understand that. And so tell us just a little bit, tell us what you did to make this look.
Okay, well, I mean, Alyssa has got stunning hair anyway, so it's by ironing it, we've actually really brought out a lot of the shine. The heat's brought that through, and I've used a lot of shine product as well. And what we've done, we've used a large GHD iron, and when we actually put it in, we put it in quite close to the scalp, and it's important to always go backwards. So the side that you're working on, you always want to face the nose of the irons down and wrap the hair backwards. And what that does is it just creates that lovely soft bit of movement off the face. And by lifting it up at the roots, we still retain that volume right in the front. I've waved it all in the same direction, and then we've just put a simple few pins in the back, and then just allowed the hair to come down around the front, and just finished her off with some air control hairspray.
Very Grace Kelly, very elegant, and certainly something that we could probably translate even to a beach look just by making it just a little less pinned and a little fluffy. Now, you're at the
Absolutely.
James Edward London Salon. Is this something you're doing these days, or is this really for the red carpet?
No, absolutely. We're doing it all the time. We're seeing girls coming in just for a night out. It's their birthday party. They just want to do something a bit special. It's quite a straightforward, easy hairstyle to maintain as well. So if they've got a special occasion on the next day as well, if you're having a big weekend, there's normally something on the next day. So it's actually quite versatile to wear it the next day as well too.
Yeah. So see, it's not just the red carpet. You can do it at home, and simple, easy, and elegant. And Nadira, let's talk about what you did, because it is phenomenal. What a match.
Thank you. Well, Alyssa's got beautiful eyes, and we really wanted to focus on the eye shape, and also really making the most of the brows. She's got lovely full brows, and just by filling them in, we create that bit of Hollywood glamour as we used to see from the Hollywood legends. And we've used, instead of doing a smoky eye using blacks or greys, I've used midnight blue. Just gives it a bit more of a modern twist. And I started by using a midnight blue micro pencil eyeliner first, right along the upper lashes, quite thickly, and then tailored that out, and then used a similar colour in an eyeshadow, press that over the top.
Made a huge difference, and it's so contemporary, but it still has that kind of 40s feel in Hollywood. Well, you did a beautiful job. You look amazing. And you know what? Hollywood, your next stop. That's a wrap.
The Stephen Handisides Show is sponsored by BMI Healthcare, Neostrada Skincare, New Skin, and Body Face Couture.
I'm Danielle Lynn, and we're talking today with Dr. Amar Khan, and we're talking about skincare. And we've been talking about, over time, the building of a foundation. And you were saying, Dr. Khan, that this is really it. This is where you lay out a foundation. What do we know from the beginning to end?
I think whenever we talk about skincare, we should be talking about cleansing the skin to start with, to get rid of dead skin cells, get rid of the pollution, anything that we've picked up. Then to treat the skin with the active product for whichever skin condition that we're treating it for. But the most important thing during daylight hours is to protect and to defend. And this is our defense strategy.
So we're defending against what?
We're defending against UV damage. Now, UV damage is one of the most aging factors for skin, and also it can increase risk of cancer.
There was a recent study that was done, and there was some confusion about whether you should use these protectants. Not good to use them. What's your thought on that?
I think with the ingredients that we're using now, they've been tested. Originally we were using chemical sun protectants, chemical filters, which absorbed the UV light and changed in their character. But those changes themselves were quite toxic because they produce free radicals which would damage the skin itself. Now we have stable chemical absorbent factors.
So when we look at these kinds of products, just so for example, the HelioCare.
Yeah, the HelioCare is phenomenal because it's got all three of the filters in. It's got the phytobiological filters, which are protecting your skin. So these mop up the free radicals produced by UV damage, and they stabilize the immune system. Then we have the physical blocks, like zinc oxide, which reflect the UV light away from the skin and protect it physically. And then we have the chemical UV absorbent factors, which don't break down into unstable breakdown products.
I go into the store, I'm totally confused. Do I get the moisturizer with 30 plus? Do I get the 50? Do I have to reapply it? You know, it's gotten to the point where you just don't have any idea. Is a 50 good? Is that what we should have on a general basis?
I'd advise a 50, but they're much better now. In the good old days, they used to be very thick and cloyy and made your skin look grey, but now they're much lighter because the actual ingredients are more scientifically based.
Thanks so much. And for more information, go to myfacemybody.com.
This is part of the show where you can ask your burning questions to our leading experts. I'm very fortunate to have here today Dr. Surinder Handal and Mr. Dirk Kramer. Right, Surinder, we're going to start with you. Now, you wrote a very interesting article in the Ultimate Beauty Guide about lifestyle and dentistry. It's more than going to the dentist, isn't it?
Yeah, I mean, from my perspective, I've always believed in total well-being. And when people talk about well-being, there's so many factors one has to consider. But if you look at the definition of well-being, nobody can actually identify it. But for myself, personally, I feel well-being is about one being comfortable, one being healthy, and one being happy.
Because let's be honest, you know, we all do get worried about going to the dentist, but you have a different philosophy on that. You change people's perceptions on that.
No, we try to. I mean, it's one of those appointments in everyone's diary that nobody's ever in a hurry to get to. That's the first thing, yeah? So you've already got a tough start. But what we try to do, we try to make the journey for them and the experience that it's all about the journey rather than the dentistry itself. So when they come to the clinic, they're greeted in a very comfortable environment. The team, it's all about the individual, looking after them. And I think from our point of view, we get the best out of the client or the patient when they're most comfortable and they're at ease. So from my point of view is, how can you ever heal somebody in an environment that isn't suited towards it? So the first thing we actually believed in is creating the right environment where they actually feel comfortable and they can feel relaxed and they can open up and share their thoughts and their views and their concerns.
Because so many times you walk into a dental clinic and I suppose we'd all agree on this, and you can smell the drills, you smell the products. But in terms of, I mean, you've got some very nice medi spas almost. They're like medi spas, aren't they? Yeah.
I mean, my belief was like when I was younger, growing up, you'd have a range of restaurants or hotels you could go to, and you'd go to different places depending on your desires. And I actually thought, why can't we create a clinic of such standard as well? Because it's all about choice as well. Patients have their own journey and their own choices. But what we try to do is break down those barriers, so when they come to us, it's a destination point for them really, and then it's a destination point where they can actually be educated and well as provide the healing parts of our treatments.
So just finally, what is the total outcome for a patient? I mean, you must see some fantastic transformations, and the look on their faces afterwards must be pretty amazing.
I think even in today's world, I mean, you know, one of the biggest things is people are still anxious, they've got phobias, they're nervous and scared. And when you can transform a patient who comes to you in that state, and they don't even want to be there, and then they go through that whole journey, and then could be 6 months, it could be a year, and then they actually look forward to it. I think that in itself is probably one of the biggest factors that makes me feel comfortable in enjoy what I do, rather than the dentistry. The dentistry is part of it anyway, but I think that's fundamental. And if you can actually instill that into somebody and they can walk away with that, then it's life-changing.
Yeah.
It really is life-changing.
That's amazing. Well, another life-changing transformation is Dr. Dirk Kramer, who's you've written an interesting article in the Ultimate Beauty Guide around facelifting, eyelid surgery, and it was called Turn Back Time. Just tell us a little bit about what was your inspiration behind that article.
Well, the inspiration was to explain the readers what my patients want in the end. They come for facial rejuvenation, means a facelift, and we talk about an upper eyelid lift, lower eyelid lift, and the biggest fear is always to look different after these procedures. And I think the approach of most surgeons is still wrong. They want to create wrinkle-free faces at all means, instead of really look behind the aging process. What makes us look old? Why do we have jowls? Why don't we lose our defined jawline? Why do we have sunken-in cheeks? And if we look and understand the physiology of aging, and we can restore the useful anatomy of the face and make the people look exactly the way they look just 5, 10 or even 15 years younger.
Now I've got a couple of questions here for you from social media, and one of them is from Anne from Hackney, and she says, I want a facelift that leaves some wrinkles and movement. Is that possible?
It's definitely possible. I think it's a completely wrong approach. Surgeons who want to erase what I said, each wrinkle, each movement of the face. This is not the goal. We want to look exactly the way we look, just by what I said 8 years ago, 10 years ago, or the goal should be that people say, well, she's 50, but she looked damn good. This is it. And over pulling the skin is completely wrong. It's again creating this wind tunnel look effect, which people are really afraid of. And the way I do my facelift, I create exactly just a younger and fresher patient, but it looks exactly the way the patient
and the case studies you gave in the guide, I mean, just showcase that really, really well.
I mean, there are lots of case studies I showed regarding the upper eyelid, and it's easier to show because a lot of my patients don't really show the whole face because they get away with it having a facelift and nobody realized they had a facelift. So posting their face, showing them before, after, I can understand that they're saying...
It's because you treat such high-profile
exactly, the high profile. And the thing is, this is the turn back time lift means we turn back what time did. That's what the TBT stands for. A lot of people think TBT, turn back time, says, oh, he makes me look younger. Well, I do that, but the philosophy behind the turn back time lift means that we analyze what makes us look older and we turn back what time did to our faces, and if we reverse what time did to our face, we exactly have our natural look, just younger.
Well, thank you, both of you, for the information. I think, you know, the viewers at home, pick up a free copy of the guide and read their articles and see some of the fantastic photos and patient case studies. But you can download it on myfacemybody.com, and you can ask them questions that you have on any of the treatments.
The Stephen Handisides Show is sponsored by BMI Healthcare, Neostrada Skincare, New Skin and Body Face Couture.